Hello everyone. Welcome to the session in which we will discuss about bone diseases. We will be talking about osteoporosis and osteopetrosis. First of all, about osteoporosis. What is the meaning of osteoporosis? Okay. Osteo, bone, porosis, pores. We can dissect this term like this. So, definition is it is a clinical condition characterized by loss of bone matrix with increase in the risk of fracture. Now, how would the fracture risk increase? Because of increase in the osteoclastic activity. Whenever there is increased breakdown or resorption of the bone, there will be increase in the risk of fracture. Okay, so in osteoporosis, the most common site of fracture is your distal forearm, and the term it is called as Colles fracture, followed by wrist, vertebra, and hip. You can see the radiographs over here. In the first radiograph, it is showing the osteoporosis in spine, whereas in the subsequent radiograph, you can see the fracture of lower end of radius, that is called as Colles fracture. Now this green colored arrow, it is representing the site of fracture. It is Colles fracture. Now about the risk factors for osteoporosis. You can see this mnemonic pattern. So it is very easy to memorize all the risk factors. First is excessive alcohol consumption, consumption of corticosteroids, loss of calcium, whenever there is less estrogen. Okay, so it includes a very important reasoning based question here, that is postmenopausal females, they are at a higher risk of developing osteoporosis. So what happens in the postmenopausal phase? Adult females, they have less bone mass as compared to adult males. But after menopause, what happens? The bone mass declines, and it occurs because of deficiency of estrogen after menopause. Excessive smoking, small stature, sedentary lifestyle, it adds to the risk factor or development of osteoporosis. Lactation, pregnancy, endocrinal disorder. We are seeing this one term over here, involutional osteoporosis. So we would like to discuss this thing in detail. You can see in this figure also, with advancement of age, there is decline in the total body calcium. Okay, you can see over here. This is called as involutional. The bone mass is more in the early life and during the periods of growth and development. But as the person grows older, the bone mass decreases, and quickening of this decline, it causes osteoporosis. So this mnemonic, it will be very helpful to memorize the risk factors. Accessible, ACCESSIBLE. Okay, it is showing all the risk factors. I had already told you about this important reasoning based question. What is the physiological basis of postmenopausal osteoporosis? I'll discuss this question once I'll complete the theoretical part of endocrine physiology. Now, what are the clinical factors seen in a person suffering from osteoporosis? Increased risk of fracture in the distal forearm, spine, hip, wrist. We had already talked about this thing. There will be increased risk of fall and kyphosis, okay, leading to widow's hump. How can we diagnose the condition? We had already seen the radiographs. Regarding the treatment part, we advise the patient to undergo physical activity. थोड़ा काम करे, चलते फिरते रहे. Dietary supplementation with calcium rich food. डाइट में कैल्शियम को बढ़ाने के लिए बोलेंगे, कैल्शियम रिच फूड लीजिए. Then we'll talk about the drugs. Biphosphonates, they inhibit the process of bone breakdown, conserve bone mass, and decrease the fracture risk. Then teriparatide, selective estrogen receptor modulator, they prevent the loss of bone, improve bone mineral density, decrease the risk of vertebral fracture. Hormone replacement therapy with estrogen. Okay, it can also be given. If estrogen is started just after menopause, it can be useful in conserving the bone mass. So that was all about osteoporosis. Now we will discuss about osteopetrosis. What is osteopetrosis? It is a hereditary disorder, first of all, and it is characterized by inability of osteoclasts to carry out the process of bone resorption. So bone resorption, it will not happen or it will get delayed. तो क्या होगा? The bones will become very hard and dense. It will lead to hardening of the bones. And the osteoblasts, they are continuously carrying out their function. Osteoblasts तो अपना काम नहीं कर रहे हैं. They are not carrying out their function. Reduction in the activity of osteoclast and osteoblast, they'll keep on doing their function. उनको तो कोई रोकने वाला है नहीं. Bones will become very hard. That's why this condition is referred to as marble bone disease. Bones will become as hard like marble. Next finding is anemia and other hematological features because of crowding of the bone marrow cavities. Okay. Deafness, neurological deficits, they can also occur because the foramina through which these nerves pass, they get altered and narrowed, because clastic function, it will not happen. Blastic function, it will keep on adding to the complications. Now regarding treatment, we can suggest bone marrow transplantation, giving vitamin D, erythropoietin to cure the anemia, and treatment of fracture. So we will undergo some symptomatic treatment. So that was about the bone diseases. We had discussed in detail about osteoporosis and talked about osteopetrosis as well. Thank you very much. In the next session, I'll talk about calcium metabolism.